Today, we would be just going through a very important and essential topic, and which is a primary source of information to the most of the MBBS, NEET, PG, and FMGE aspirants. A question always on the back of the mind of the students: what should we read? What are the books recommended, which will help us in the preparation of their NEET, PG, FMGE during their MBBS, and which will be having long-lasting effects on their curriculum. I mean to say that many of the students read books and then at the end of their final year, they are lost why we did not study the right matter, the right content, because there are so many things which are around, so many books, so many authors, so many pseudo, I mean to say authors, so many pseudo books, everything chat GPT derived, so many copy paste, Instagram, Telegram, WhatsApp, and you do not read on Insta, Telegram, WhatsApp. The best of the students are those who have got a conceptual knowledge from the most of the standard of the texts. So I would just recommend certain important facts to the students, certain important points which will help them in a long way. So it is not teaching. Teaching is an art. Everybody does not perfect that art. There can be so many people who will lecture there, people from the I would say some categories who have not gone through the merit, who have not come up from the merit, and they lecture and advise about the merit. So it is not well taken by many. So to be, you should be basically taking up credible sources of information, credible advice, and the advice which may be, I mean to say, there is no easy path to success. Maybe sometimes you have to tread a difficult path, but the path definitely will lead to your goals. So, bit of a hard work, a bit of a suggestion which is needed in a right manner, and that will help you. So, as far as the books are concerned, we start with the anatomy. And what forms the basis of anatomy? What is anatomy? So many regions: upper limb, lower limb, thorax, abdomen, neuroanatomy, head and neck, surface anatomy, radiology, embryology, histology, and what will give you an idea. Basically, image based concept. Grant's Atlas of Anatomy, I find that this is one of the books which gives you, I mean, say, a good description of the diagrams up till and unless at this point of time now. For any examination, if you do not have a good correlation of your knowledge along with the image based questions, from any region which I just mentioned. So Grant's Anatomy, Atlas of Anatomy is one of the important atlases which you can take help of for preparing your anatomy as far as the figure based, image based questions are concerned. This atlas is a very important and well, I mean, say the figures are of top quality, top notch, and that should help you in your preparation and gaining an idea. So, grants. Now, as far as the dissection hall is concerned, we sometimes underestimate the value of dissection teaching and Cunningham's Manual of Practical Anatomy. Yes, definitely a bit of a tough book as far as its English is concerned. But if you really want to grasp the basics of anatomy, the dissection part, which is a very important and which will help you a long way in understanding anatomy as far as your NEET PG is concerned, the basic concepts you will not forget are from the Cunningham's manual. And I would encourage every student right from the beginning to just study Cunningham's manual, especially the text and the mode of appearing and preparing for the dissection. That is very, very important. So, this would aid you in the long term. I am not talking about the short term benefits over here. I am talking about the long term benefits of the books which you should use, because they tend to give you the real knowledge what you need. That is why these books, despite having, I mean, say, so many editions and very, I mean, they have been running there for a long period of time, they do have not lost their value. So that's very important. Yes, definitely one of the books, BD Chaurasia, I find it better than most of the books in the market. There are so many books which have come up, but I think that that's a copy paste mechanism in many of the cases. No, I don't want to just take the credit away from some of the good authors who have just used innovation and improvised upon anatomy as far as the things are concerned. Because anyway, some of the things in anatomy tend to be static. The branches of internal mammary artery, external carotid, internal carotid, any vessel, any nerve remain the same. So what innovation you will bring in, that is the point. How you bring in innovation, how you make the anatomy more interesting, how you make it clinically oriented. And I find that many less authors are of that caliber who have come to the expectations of the students. And basically what happens, that static anatomy which they have just done, coming up with these the routine one, two, three volumes of the books, and divided it with not much of inclination as far as clinical knowledge is concerned. Just the same things there repeatedly. As fundamental, BD Churasia would retain a fundamental pillar as far as such type of a book is concerned, and I would definitely recommend it. Basically, the older editions were better off with the new, I mean, say, authors who edited the books and just decreased its quality, made it a comic type of a book, unfortunately. So I would just recommend it in any case. So that is one part. Now, we do not have anatomy as far as only regional is concerned. We have surface and radiographic anatomy, which is very important from a surgical viewpoint. And then there is this A. Halim, late Dr. Halim, who was a pioneer in anatomy, and his book stands tall as far as this, especially this aspect of anatomy is concerned, because anatomy is a huge subject, a vast subject, and this thing should be done from a long-term perspective as far as understanding the radiographic anatomy, which is very helpful in medicine and surgery is concerned. Now, Atlas of Histology, DeFore's Atlas, the best of the atlases with precise, well defined diagrams of high quality, high imagery used, high magnification, low magnification, precise details of the microscopic anatomy. And most of the slides are well marked. There are so many atlases, but I favor DeFore's as one of the best atlases in anatomy. I mean, say microscopic anatomy, histology, and it is irreplaceable as far as other atlases are concerned. I'm not recommending here for any commercial purposes, but the thing is that this is just to give you a prelude what benefits the students the most. And this is a time tested thing. I'm not talking about the new things, because we find so many questions coming from these books as far as your NEET PG FMG is concerned. So these books have their value, these books have their own value. Now, as far as embryology is concerned, Langman's embryology, concise, precise, latest genes, genetic, molecular level, beautiful diagrams. I'm a bit of a tough English, but you can overwhelm that by virtue of just reading, because so many questions, especially DM, MCH, and NEET PG are also asked from, I mean to say, Langman's embryology, a high yield book for all practical purposes. So that covers a bit of an anatomy. And in addition, human osteology is a very important component of anatomy. There is this Nafis Faruqi book, Professor Nafis Faruqi, who has just given a very precise, well arranged, systematic book as far as osteology is concerned. Very helpful for surgeons, very helpful for orthopedicians. I find many orthopedicians, physiotherapy, nursing, medical students on the top notch taking this book as far as osteology is concerned. So this is something about anatomy. As far as physiology is concerned, so many books, I again repeated, there are so many books in the market, but eventually Guyton Hall is one book which retains its value, a well demarcated, a well prepared with a lot of, I mean, say, explanation, in-depth knowledge about physiology, which will aid you in the preparation as far as medicine is concerned, because medicine is applied physiology, and you get so many fundamental questions from this book as far as physiology is concerned. Myself, I've also studied Guyton, study, and still from the feedback from most of the students from all top-notch institutions in India, abroad, they still recommend Guyton Hall as one of the best books of physiology. So physiology would do, and in addition, you can take help of smaller books which are there in the market. I will not go into that. And as far as biochemistry is concerned, biochemistry books like Stryer, Leninger are the fundamental cornerstones, but not for UG level. For UG level, I would, I mean, say, recommend Lippincott's biochemistry. If you have not read Lippincott's biochemistry is incomplete. The way Lippincott has been prepared as far as clinical scenarios are concerned, as far as the fundamentals of biochemistry are concerned, the genes, the development, the pathways, the cycles, the description, it is unmatchable. Lippincott is one book which retained its value as far as British students are concerned, American students, Canadian, Australian, and Indian students. Your biochemistry now, because the way it has been given, your neonatology and pediatrics will be very, very easy if you study biochemistry. And the fundamentals of biochemistry are to be had strong, because nowadays so many bulk of questions are asked from a biochemical viewpoint, from a genetic viewpoint, from a molecular viewpoint, from an enzyme deficiency viewpoint, and the clinical presentation, which is so beautifully given in Lippincott. And biochemistry happens to be one of my favorite subjects, and I just would recommend Lippincott as far as biochemistry is concerned. So then after that, pathology. Pathology is a major subject. There are certain major subjects like anatomy, pathology, social and preventive medicine, medicine in itself, surgery, gynae ops. They happen to be major subjects, and you cannot escape because of the huge quantum, huge chunk of questions asked from these questions, these subjects, as far as NEET, PG, FMG is concerned. And Robbins. Robbins is one book which, if you have read it, half of Harrison is Robbins. So I mean to say that the basis of medicine, which you find in Robbins, is replicated in Harrison, which is one of the best books around. And the Robbins gives you a precise ideology of what pathology is for an undergraduate, for a postgraduate student. And I have seen DM, MCH, the oncopath students also retaining the Robbins. I find anytime I meet my pathology friend, the book is always present on the table. So Robbins in itself is something which is unmatchable. And once you read Robbins, the once you are doing medicine, the effort in medicine will be just half, because half of medicine you have already covered in Robbins. And then the number and the quantum of questions which are asked from this book. I mean, the references there, and you cannot escape Robbins as a standard textbook. Most of the important, if not all, but I would recommend all the important topics, high yield topics, to be studied from Robbins as far as pathology is concerned. Now, social and preventive medicine, there is this book Park, and Park again, like Robbins, though Robbins is an international book and Park is an Indian book, but still there is no alternative to PSM or SPM, whatever you call it, as far as Park is concerned. In fact, some of the diseases, communicable and non-communicable diseases, given in Park, and the epidemiology and the latest programs which are there in social and preventive medicine, this is the book which is updated on a frequent basis, and Park leaves no stone unturned as far as social and preventive medicine is concerned, and the cache of questions asked in your respective examinations are concerned. And talking with many experts in social and preventive medicine, they just recommend this book on the whole. Pediatrics. Pediatrics, I would just mention two books, Nelson and O.P. Guy. Maybe I have not placed a photograph of O.P. Guy over here, but Nelson and Guy, these are the two fundamental cornerstones of pediatrics. Myself having studied Nelson's, and Nelson's is an alternative of Harrison as far as pediatrics is concerned. The way it is given simple, the clinical scenarios, the description of the diseases, the microbiology of the disease, the pathology of the disease, the clinical outcome of the disease, the clinical diagnosis, and the lab values, and the, I would say, the treatment part is the best because it is modified and updated to the latest. Nelson's retains its value as Harrison's of pediatrics. So no compromise, no question. Yes, in case you want some topics, OP Guy is also an alternative, and that should be taken into consideration. Um, Harrison's. um, uh, Bible of medicine. So, as far as Harrisons are concerned, I think that any student of medical sciences, if he or she has not studied Harrison's, his or her knowledge is incomplete. Now, you cannot go on revising 50, 60 times Harrison, but 2 to 3 revisions in depth will give you a total concept of medicine. Some of the concepts are borrowed from Robbins, as I mentioned earlier. Harrison is one book which is almost a complete book. And once you read Harrison, I don't think you have to take help of any other book in medicine. The concepts are there, and I would recommend most of the important topics, most of the high yield topics which are there to be read from this book. There is no alternative to Harrison as far as medicine is concerned. So all the branches, rheumatology, cardiology, gastroenterology, hematology, oncology, from Harrison, they are remarkable. As far as the authors are concerned, they have done a great job in preparing this book, and this is a world-renowned book. You go to any continent, and this book you will be always seeing with the people who are dealing with different aspects of medicine, even I would say from allied branches as well. This book retains its value, and there is, if you say anybody tells you that the reference is not from Harrison, you will have to think twice whether really the answer option is correct as far as Harrison is concerned. So that is something which I just want to mention as far as Harrison is concerned. So Harrison one should read in lifetime at least once, if not twice. So that is recommended highly. Surgery, there are so many books, Schwartz, Sebastin, Bailey. But as far as UG are concerned, because Harrison takes a lot of time, you have got less time in medicine. The recent NMC curriculum, so many subjects in your final year, people tend to get frustrated. Boys, girls, I have seen students getting frustrated. So many subjects to prepare. I don't know what the NMC is doing as far as the curriculum is concerned. They have just placed a lot of burden on the students, and it is, I mean to say, unfortunate that so many subjects have been put in the final year, and that's why students, I would not recommend big books like Schwartz, Epstein. Law and Bailey is one book which is short, precise, concise, and surgery can be well studied along with orthopedics and other parts which it covers very aptly and very decently. So Law and Bailey I would recommend instead of other books which are existing there in the market. Now, as far as gynae and obstetrics are concerned, two books, Williams Obstetrics and Gynecology, and Datta. These are the two books which are read by most of the students in India and for FMGE as well as other, I mean, say examinations. These books retain the value as far as obstetrics and gynae are concerned. And obstetrics and gynae is one important subject which has got. Now, what is important about this book? The way the obstetrics and gynae has been given, it is in a conceptual manner. It is a flow. It is just like as if you are reading a novel. And the retention part from Williams, from Harrison, from Robbins is high. That is why the recommendation for these books. These are the basic standard textbooks. I would say why these are being read all over the world is the way the authors have presented them. They are not diluted. I mean to say, even if they have retained their basic ideology. Say, for example, there are certain books in the market written by previous authors, international authors, and now they are edited by certain other authors. It is like oil and water. You can just make out what part is oil and what part is water, and you have mixed different ideologies, and that is the worst part of these books. That's why Williams, Hadson's, Robbins, they have been edited by authors in such a manner that they have retained the, I mean say, the concept of the original author. That is why some books which are there in the market edited by some authors, they do not do well. They do not sell well. I tell you frankly, we might make a huge hue and cry about these books, but they do not well. Nobody takes them now, and in fact many of the I mean say great teachers, they just read the older versions of those books, unfortunately, for these editors who have just destroyed the basic concept of these books. So Williams, obstetrics, and then as far as ophthalmology is concerned, ophthalmology is more about image-based and cataracts, image of cataracts, colobomas, I mean to say, then so many corneal opacities and the conditions affecting the iris, the cornea. This is one book which has got image-based, and you should read it along with Khurana, which is a book which is highly recommended for the undergraduate students as far as ophthalmology is concerned. And it has got a good collection of images, high quality images, which you will never forget in your life. So that is as far as the standard textbooks are concerned. And as far as your preparation for the NEET PG now starts, I would just tell you these are Platinum plus Cure Bank, Volume 1, Volume 2, Volume 3. All the 19 subjects given in a systematic manner in these books. These are questions based on all the subjects: anatomy, physiology, biochemistry, pharma, up to radiology, all the 19 subjects. These are my books, and I know the amount of work I have done on these books. I mean to say, they happen to be the favorite of the students in most parts of the country. And the level of the questions is there. They are very well preparatory books for NEET PG, and I think that they do well. And they have been prepared with a lot of concentration, highly concentrated questions, very good explanations, and image-based questions as well, retaining many of the things as well which are there. For FMG, FMG Blitz is a book which is highly recommended for the latest because it is lately prepared. And in addition to that, we have got the NEET PGQR, so Platinum Cubic, FMG, NEET PGQR, and the Platinum Pathology Cubic. These are some of the high yield books which are there in the market for a NEET PG preparation. I mean to say that these are supplemental books. These are not uh, standard textbooks, the Platinum Standard QP UPSC CMS, my book for UPSC candidates. And this is very helpful with a lot of questions being covering all the latest subjects, latest questions, frequently asked questions, previous year's questions. And then this is all about what you should study for your exams, whether it is NEET PG, FMG, INICET, UPSC, and these books will help you in combination. And you make notes of your own, take advice from your good seniors, take advice from your good teachers, and I wish you best of luck for your examination, whatsoever examination you are preparing for. And I thank you for your attention to this small briefing of mine, which I think will benefit you in just preparing for your examination. In addition to the online core banks, standard core banks, you practice the MCQs, go on practicing, and that will help you. But the basic knowledge of the standard textbooks, which I mentioned to you, and some of the supplementary books of mine, which I mentioned, very frankly, will help you in getting top merit, and that is what you aim for. So best of luck for your endeavors, and that's it. Thanks a lot.